I want to share another story today about a person who's close to me, a member of my staff. His name is Rich Pezzillo, and he has hemophilia. He's gotten the treatment that he's needed so far, but he has been lucky, and it illustrates how luck now enters into our equation in healthcare. In 2003, after a very turbulent airplane flight, Rich unfastened his seatbelt from the airplane, collected his things, and suddenly realized things were going badly wrong. He started to feel tremendous pain. He started vomiting blood. Simply wearing his seatbelt in that turbulent aircraft had caused Rich to begin to bleed internally, inside of his stomach, eventually requiring that his gallbladder removed. Rich is a kind and thoughtful young man from North Providence, Rhode Island, and he was hospitalized in very serious condition. He spent roughly 3 weeks in the hospital. Thankfully, he received excellent treatment, and today he works here in my Washington office. The doctors, the nurses, and the hospital staff in Rhode Island gave Rich the best treatment. He now leads an energetic, vigorous life and does well at a challenging job. But the stunning part about Rich's story isn't his treatment, it's his treatment's cost. $1.5 million. At least that's what they said. If you look at a copy of the billing sheet, you'll see that the insurance company said that his billing here, for instance, was $366,206,000. That's what actually was paid, which gives you a sense of how much funny business is going on in the private health insurance industry and in the healthcare sector when an insurance company can get away with paying about a third of the billed cost. We've heard a lot of talk around here lately about how burdensome it is for members of Congress to make it through a 2,000-page long health care bill. But rather than fighting about the 2,000-page bill, how about Rich's $1.5 million health care bill? The hard truth is that Rich was able to get life-saving treatment because he was lucky. He hadn't yet graduated from college and was still covered by his parents' insurance policy. Because he was covered, the hospital only charged his insurer that $106,000. What if things had been a little different? What if he'd needed treatment a couple of years earlier when he wasn't on his parents' policy and couldn't afford his own? A couple of years later, I mean. What if he'd applied for his own coverage but was denied by an insurance company because his illness was a pre-existing condition? What if Rich's father had lost his job and his health insurance along with it? Or what if Rich's parents' policy had a limit on benefits, so they had to pay the rest of the $1.5 million out of pocket? In all of those situations, Rich would have been a victim not just of his illness, but of the healthcare status quo. He or his family had been uninsured. They almost certainly would not have been able to afford the full care that Rich needed, and their financial future would have been irrevocably altered, probably ruined. Luck is no way to run a healthcare system.